Hello and welcome. You are watching News 9 Live. I am Krishna Kumar, and at this hour on News 9, we are discussing something that's very important for all of us to know and understand. Is there a link between COVID-19 and the spate of heart attacks that has been caused? Let's now dig deep and understand. Ever since COVID-19 struck, there has been a continuous uptick in the cases of heart attacks across the world, even as the government of India conducts COVID preparedness checks across the country. The Union Health Ministry has also initiated a probe led by ICMR into finding if there is any link between COVID-19 and heart attacks. And the results are being anticipated as soon as within 2 to 3 months' time. We have Dr. Sunila Garg, member Lancet COVID-19 and advisor ICMR and WHO, joining us live on this broadcast. We also have Dr. Dinesh Chandra, cardiothoracic and vascular surgery and HOD Max Super Specialty Hospital, joining us live on this broadcast. Thank you, both of you, doctors, for being with us. Let me begin with Dr. Sunila Garg. Dr. Sunila Garg, I want to understand, prima facie, what are your thoughts on the links between COVID-19 and heart attacks? And I also want to understand not just the disease COVID-19, but also the vaccines for COVID-19 and heart attacks.
See, basically, first of all, Krishna, thank you for having me on the show. I would like to bring one thing, since, COVID has happened, since last 3 years, and post-COVID phase, now we are seeing a lot of cases of sudden heart attacks and all that. But it is important to understand through verbal autopsies that basically how these deaths happen. So we have to look at the reasons, what are the causes of deaths? And these are particularly happening in long-term COVID cases. And we do have to understand that what is the difference between these sudden COVID deaths. One important reason is that this is electrical malfunctioning of the heart, in simple words for the people to understand. And it is different from, when we talk about that there is an arterial blockage and all that, and then people die due to heart attacks. So that is another thing which we need to understand. But you see, in order to, if we have to talk about, cause and effect, in that case, we have to really look at, the complete verbal autopsy of the individuals who have, whom we have lost due to heart attack, as to, the complete probing into the history of the disease, their vaccination status, their, whether they were in ICUs and they were hospitalized. So we need to look at the complete cause before we can say that it is attributed to a particular cause. But definitely we have understood COVID, but not to the extent, every day it is posing challenges to us. But it is important to really look at through verbal autopsies about before, ICMR comes out and reports properly about the cause of death.
Right, Dr. Dinesh Chandra, I'd like to bring you in at this stage. Tell us, from your perspective, how much of a link is there, and more importantly, what do we need at this stage to understand, when it comes to COVID-19 and heart attacks?
Thank you very much for having me here. So at the outset, I will say, COVID has definitely, there is a relation between heart attacks and young heart attacks with the COVID. Because what in my practice I have seen, because after the resurgence of the COVID when it started 3 years back, Madam rightly said, it is the lifestyle which has changed drastically. What the people used to do 3 years back before COVID and now it has changed. The stress level, so many things have changed. And COVID virus itself, it has changed bodies, the coagulation parameters, the arterial walls, and so many things have happened. The COVID vaccination also had added to the problems. So what I understand, there is definitely some relationship between COVID, its vaccination, and the young heart attacks.
Right, that's very important to understand, isn't it, Dr. Sunila Garg? The heart attacks that are happening, that are taking place for very young age people. These are not, people who are prone to heart attacks in the normal case scenario.
See, and normally what we see in older cases is because, we see the arterial walls and all that getting blocked, because of the plaques and all. And this happens over a period of time. But as I told you earlier also, this is because of the electrical malfunctioning, because there's a conduction defect, that's where we are seeing a lot of young deaths also. And why? Because there's change in lifestyle. They're the ones who are indulging in, rapid I'll say the exercises, gymming and all that, or dancing and all. So we have seen a lot of cases because of that, these reasons also. So that's why we see more of younger deaths because of, proposing rapid strain, on the body. And also we will like to see that before we jump into the conclusion that this is because of the vaccine, we always see the cause and effect relationship. So that's where I said that we need to go into the verbal autopsies completely, find out the complete history of the individual as to, what kind of COVID it was, whether the person was hospitalized, it was, mild, moderate, severe type of COVID, whatever it was. And then along with that, about the history of vaccination and all, because there is a lobby also which talks about that we do have vaccinations around, but at this point of time we cannot comment, because we also need to look at the fact that vaccines probably, saved us from moderate to severe infections, hospitalizations, and death. So that is where we are here to kind of look at, the proper investigation, so that people do not get unnecessarily scared, but they need to modify their lifestyle. If they have suffered from long-term COVID, they need to recuperate and they need to take the life a little easier. So that is why it is important to first look at the cause and then come to the conclusion. But definitely there is no doubt about it that post-COVID has affected every organ of the body, right from
Right.
top, if we talk of to the fogging and all that. But then sudden COVID deaths due to, heart attacks and all, they are problem, because we lose a person, and that to young death. So that's where it is important to look at, and we need to probe in depth. And that's where ICMR has commissioned this study, and where, a team of AIMS doctors is being involved. And within 2 months, they're going to submit the report. And we
Right.
all know that post-COVID symptoms are, still persisting in a lot of population, with chronic fatigue, feeling unusual and all of that, and, myalgia continuously. And a lot of people, still have a lot of, symptoms which are related to different parts of body. And also, still we are seeing a lot of cases of cardiac arrhythmias and all that. If you talk to cardiologists here, I have my colleague here who is talking about that. So that's where we need to counsel the patients, and we need to
Right.
apprise them that if you have recovered from COVID, take it easy. Do not do exercises very rigorously. Do not go to the dancing floors immediately, because COVID has still not gone out of our lives, and it is posing a lot of challenges to our body, and we need to still understand a lot more about COVID.
Fair enough. Fair enough. Dr. Dinesh, Chandra, COVID is still posing a lot of challenges to us. Talk to us about two things. One, I wanted to ask is long COVID and the relation to long COVID and heart attacks. And the other thing is, there was even talk of, how taking the vaccines, vaccines also have the probability of causing heart attacks. Tell us, how much truth is there to these two things?
So, as rightly said by ma'am, it is everything we are attributing to the COVID. COVID is doing so many things to the body. And once the sudden death occurs, people only think of heart attack. It has never been investigated. It was really a heart attack, because heart attack is a vague or layman term, you can say. There has not been an autopsy of the people who are having these type of attack. So COVID can cause so many things. For example, a person is having sedentary lifestyle. He is sitting for his work for 24, 36 hours, something like that. There is a clot in the leg, it gets mobilized to the heart, and there is a heart failure in that time. So it can mimic like a heart attack. The patient can have that problems. The other thing is arrhythmias we are talking about. Patients are having heart tachycardia, the heart rates are racing like anything. So these are leading to chronic heart failures, and then suddenly can be having a precipitated arrhythmia and ventricular tachycardia leading to cardiac death. So these are not all heart attack as such. So I just wanted to tell you, COVID is doing problems, and it has to be customized for the patient. We cannot just attribute everything is heart attack, first of all. Again, as rightly said by ma'am, lifestyle has changed drastically. We have been on any viral illness, the body immunity, body preparedness to fight things decreases like anything. And suddenly we jump one day, I am feeling fine, we go to a dance floor or a heavy gymming without, it is not guided by any principles or maybe a trainer or something. So such things take a toll on the heart and can have a massive problems. So we should be careful in choosing and how we are recovering. We should be careful in doing that. It is not like everyone can do everything. We have to customize our body to our needs, and we have to know that COVID is doing problems. So we have to go slow.
Okay, let me take this back to Dr. Sunila Garg. Dr. Sunila Garg, when it comes to heart attacks and young people, what are the measures or steps that people need to take? Tell us in terms of the age group. Say 18 to 40 people. How do they know and how do they need to be aware? And what are the steps that they can take to make sure that if whether they are prone to it in the first place, and if they are, what needs to be done then?
See, first of all, it is very important across all ages. And since we are seeing, cases more in the younger age group, so there's a special message for younger age group also, because over a period of time, since last 3 years, we'll see the lifestyle has been very, very sedentary. And people have been, putting on weight and all that. So that's where it's more of going to gyms and all that to lose weight very suddenly. So one message is that you should be, very particular about your lifestyle. Number two is that you cannot lose weight suddenly. That is important role of diet is also there. And whatever exercises you should do, you should not, that should not tax your body so that you become so breathless so that you cannot even, kind of speak. So that is another important thing. Another thing is that basically if you have suffered from COVID, it is important that doctors will also say that, particularly if you have been there in ICUs or you have been, it depends on the type of COVID. And over a period of time, we have been monitoring cases who have suffered from COVID after a period of 3 months, 6 months, 9 months to see, and that's where the advice is being given to doctors as well, how and what kind of symptoms are they seeing. So follow doctor's advice. Do not, take your own treatments. Do not be, in one, as I'll say that another year, life is not going to change. You are going to recover over a period of time. So give time to your body to recover. But still also another thing is that when we talk about vaccination and all, we do have, another round. I'll say that, we are seeing a lot of cases of COVID which are milder in, nature now. We are not seeing many hospitalizations, and not particularly it is because of the vaccinations which we have taken. And that is where, also at same time we are advising, precautionary dose to people who have been, elderly and who are suffering from comorbidities. So idea is not to create a fear. Idea is that please lead a lifestyle which is, I'll say healthy lifestyle and a wellness lifestyle. So if you're stressed, please, believe in yoga, meditation, and practice that. That is important. And have regular consultations with the healthcare provider to whom you have been seeing. And I will again say that another 1 year will not make a difference. So avoid stress of any kind and do not go for very rigorous exercises just because you put on weight or just because you want to, go back to your original lifestyle, because COVID is teaching us a lot of things, as I told you in the beginning as well, Mr. Krishna.
Right. Dr. Dinesh Chandra, in that sense, it's very important to go on these, fad diets and crash diets and etc. as well, even as you're trying to, alter and make your lifestyle better. Dr. Dinesh Chandra, if you can hear us.
I understand, like what I advise my patients, like it is, you have to understand what is your risk factor. It is, you cannot compare yourself with your friend or your family. Your risk factor may be totally different from what the other person is having. You are having some substance abuse, like you are a smoker or alcoholic, then your condition, inside condition will be different from the person who is just not taking anything. Similarly applies for the stress, your sleep habits, what you were before COVID era. And again, the type of COVID you underwent, as rightly said by ma'am, if it was a mild thing, then it is okay. But when you had a moderate to severe COVID, your body immunity, your body resistance, everything has gone down. You may have taken so many steroids and all those things. So you cannot just go and forget COVID and then do all your lifestyle things. You have to justify your own what you were at past with the present and then think about the future. It is not one day affair. It is a lifestyle that has changed. One more thing I just wanted to add, as it was said, why young deaths, why older people are protected. It's not like that protected. Old people have slow progression of diseases. That's why they have collaterals in their heart. But when young people have some blockage or sudden event, it is fatal because young people collaterals are not developed. So that is the age giving advantage to the old people in this case. That's what my understanding is.
All right. Would you concur with that, Dr. Sunila Garg, what Dr. Dinesh Chandra is saying?
Definitely. I think it is very, very important. And two things which you pointed out for, the youth And I will talk of both forms of tobacco, whether it is smoked form or smokeless form. It's not only that when you smoke tobacco, then only it's dangerous. Even like when we talk of gutka, when we talk of red manjan and all, there are different forms of smokeless tobaccos also. So we have to be, kind of looking at the lifestyle in form of that. Any kind of substance abuse, that is important. Alcohol also. And as was rightly pointed out, that basically we need to look at, exactly the progression of disease is very different in elderly as compared to youth, but we need to counsel and counsel and counsel. And please remember that one should not become their own doctor. It's better to consult the healthcare provider. And especially if you have suffered from COVID and you are feeling anything unusual or something like that, that today I'm not feeling well and I'll go for long walks and all that. No, it should not be tiring. Take it easy. That is important. Another thing is pay a lot of attention to your diet. And for some time, if you have suffered from long COVID, we'll say that you better avoid, the diets which are rich in fats and all that, and so-called fast foods and all that. So it is important to take balanced diet with a, good mixture of, protein, protein, fat, carbohydrates, minerals, vitamins, and all that. And we do, believe in, healthy food. That is important, and I think, these are the messages for the young people, but important is to avoid stress. That is important. And please make sure that you have a lifestyle which is, which we call it as we go from health to wellness so that we feel well. It is not only being healthy, but it is also feeling well. That is important.
Right, and in that sense, you've seen these, big stars, who have passed away because of heart attacks. In the recent past, we have, actor Siddharth Shukla at the age of 40, Kannada actor Puneeth Rajkumar at 46, and Andhra Pradesh Minister Gautam Reddy at 50, and singer KK Menon at 53. That age group, of 40 to 50 right now seems like the most prone to it. Let's talk about that age group and what they need to do, because they are traversing a phase in life when the body is not what it used to be in their 20s and 30s. Dr. Sunila Garg, if you can hear us.
Is it asked to me or?
Yes, you can please go ahead.
Should I answer this question?
Yes, please go ahead.
Yeah. So basically what I wanted to say that when we have lost these stars because of this, if you will see that most of them were involved in some activity, and probably, the initial warning signs are not taken very, very seriously. So even if, while you are doing exercise or while you are, involved in a particular activity, make sure that any kind of unnatural or something which is, not according to your normal, you cannot say that, after this, let me perform this activity, and after this, I will rest. The moment you start feeling little bit, restless, or you feel that you are breathless, or you feel that something is not tuned to, please stop that activity. That is important. And also the important part from the healthcare system is that we must have emergency plan ready. So that is where we do have, basic life support, advanced life support. So one should take immediate, and everybody should be trained, in fact, in, looking at advanced life support also, because there are now trainings going on in reviving these kind of people. So it is important to, first of all, the messages for those individuals, and let them not, even if they have not performed for a year or something, and they're professional performers, so they should just halt the moment they are not feeling well. So it is important to look from that perspective. So there is a special message from them, and do not have long performances for 2 hours, 3 hours and all that. That is important. And another important part is that, as I said about regularly about the gymming part and all that. So one should, and one feels that, they are into this activity. So gymming is really required. So one should look at that. But everybody at this point of time, whether it is concert or whether it is a shooting or whether it is any kind of a, film shoot or anything. So one should be watchful also at this point of time. And the person should immediately give a signal that, basically, I'm not well, just stop it. So I will say that immediately right now, whatever concerns are also there, one should reduce the duration of that. And, at the moment anything is unusual, one should stop doing that. And
right.
as I can see in the visuals, very, very rigorous exercises, and one wants to be, I'll say that, we all have that Hrithik Roshan syndrome or Kareena Kapoor syndrome. One wants to be, like that, but there is a time for that. I'll say that,
Fair
as I
enough.
said, that we need to relook at the situation completely.
We need to relook at the situation completely, is the word coming from Dr. Sunila Garg. Thank you, Dr. Sunila Garg and Dr. Dinesh Chandra, for joining us on this broadcast and helping us understand what the link between corona, COVID and heart attacks are. And with that, it's a wrap here on this edition of News 9 Live. News and analysis continues. Keep it with News 9.